Hello and welcome to the newest edition of Pharma Talks. Today we're going to be talking about how three major corporations, including Amazon, are tackling healthcare. But before we get into that, I'd like to remind you to rate, review, and subscribe. Hello and welcome to the newest edition of Pharma Talks. My name is Alex Hernandez. Alongside me as always is Dr. Craig Stern. And our topic for today is how Amazon, JPMORGAN, and Berkshire Hathaway Berkshire Hathaway are going to tackle healthcare. And this is how they're going to tackle healthcare. They have some goals in mind. And what particular goals do they have in mind? These three major corporations that have a ton of employees spread all throughout the United States, how do they plan on tackling healthcare?
Well, I want to talk about what each one brings to the table. But before that, fundamentally, they, as everyone else, wants to lower the cost of healthcare. Mm-hmm. Certainly lower the cost of drugs. Okay. Number two, they want to tackle quality because they want to make sure that if you spend $1 on healthcare, that you get the value out of that dollar, right? And the third is to make sure that there is safety, that risk is being reviewed and being monitored so that people are safe. So lowering cost, improving quality, and effectively making sure that the healthcare system is safe.
So technically, save money, ensure quality, and have happy patients. Or satisfied patients. Okay. So what do all three of them bring to the table?
Yeah, this is the interesting thing because a lot of people have talked about it, but no one is quite sure what the plan is. Mm-hmm. And none of them have identified what the actual plan is. But for purposes
Seems like a great plan.
I think it's evolving. It's a process.
Right, of course.
But I think it's important that we address what each one brings to the table.
Okay.
There's been a heavy emphasis on Amazon, and rightfully so, because Amazon has a significant expertise in distribution, significant technological expertise so that they can track and deal with the analytics of what people are using, etc. And then clearly a terrific logistics to make sure that people are getting help right away.
Like free one-day delivery.
Yeah. We're not doing books right now. We're doing
awesome
healthcare.
Service. Awesome. Okay.
But the other question that people are not asking a lot is, because they're not quite sure, is what do the other players bring to the table? If we're talking about lowering cost, Berkshire Hathaway, aside from the fact that it has a lot of employees, a lot of HR or human resource kind of knowledge that can be brought in, they are experts in reinsurance.
Okay.
Reinsurance means if I buy a premium and I get insurance for myself or my family, when costs for certain things are very high. So simplistically, if the drug cost is very high or a hospital cost is very high or a service cost is very high, then they buy reinsurance to cover those extenuating circumstances. Okay. So everybody that buys insurance doesn't have expensive or extenuating circumstances, but a certain percentage of them do. Okay. And the reinsurance tries to cover that. Why is that important? If there's a reinsurance component, then it lowers the cost of premium for everybody else. So in one way, the premium cost is decreased and the cost of healthcare in general is decreased by having a very active reinsurance program. Sometimes states do that or others, but in this particular case, Berkshire Hathaway can bring its expertise to the table for that. The second issue is that Berkshire Hathaway is an expert in addressing insurance for whether the initial costs have been met, meaning insurance, it's called the first dollar payment. But in reinsurance and the way that Berkshire Hathaway and other reinsurers look at it is, are the other insurance companies doing their job? Are they not just lowering the cost, but are they also looking at it to make sure that it's appropriate therapy, that it is therapy that fulfills particular guidelines,
Right, so monitoring.
etc.
Right.
So it's monitoring that,
Right.
and they're experts at it. So Amazon, with regard to their logistics and their ability to attack the profit margin, to cut that down. Berkshire Hathaway to take a look at reinsurance in order to try and cut down on premium costs, as well as to make sure that other parts of the insurance program are being monitored appropriately. And the third is JPMorgan. Now, JPMorgan is an investment bank.
Right.
They certainly have retail banks through their Chase subsidiary, but they're an investment bank, and it's been addressed recently, and we have it. I've written about it, and Emma's going to add it and link it to this this particular Pro Pharma Speaks. Is that
Thank you, Em.
the investment bankers are now looking at the rest of the world and saying, we're going to include human resource planning in our portfolio of services. As investment banks, they've been very strong in getting to the so-called C-suite, the CEO, CFO, COO kind of people, in coming up with appropriate investments in order to build the profits and revenues, perhaps mergers and acquisitions. But now they've said there's a new market for them, and that's to go after individuals. And they're going to go after it through human resource by providing technology, web-based programs, etc., to help people with their overall HR. Why does that matter?
Why does it matter?
Well, Alex,
Sorry.
it matters. It matters clearly in order that people get more information and that they get it in a relatively cheaper way, doing it digitally. But the larger issue is that they bring something else to the table. They're bringing the bank to the table. The importance of it is that as cost rises, whether it's healthcare through hospital and services, whether it's drugs or otherwise, they're bringing the credit card, the investment part to it that deals with debt.
Right.
And so they're bringing the, quote, credit card, that could also be other forms of debt handling, to the table, so that what has previously been handled with regard to healthcare insurance through the plan, middlemen like pharmacy benefit managers for drugs, or TPAs, third-party administrators for insurance, these people are based on getting the profit, keeping a piece of it in order to cover their costs, and then passing along the rest of the savings. Well, what the JPMorgan brings to the table is they're bringing potentially a new method of dealing with the entire insurance product by saying, okay, we're giving you information about what to use, and now we're giving you the opportunity to be able to afford it through debt, the way you would buy a car, the way you would buy a house, the way you would buy really expensive things in your life. They're bringing that model into
drugs.
Like drugs, and certainly specialty drugs that are now half of the drug cost and are rising rapidly. Think about it for a moment, even with regard to drugs. About 15% of the population uses about 50% of the drug cost in specialty drugs. Specialty drugs being injectable drugs that you would use for cancer or rheumatoid arthritis or MS or hemophilia or things like that, right?
Just for clarification for you at home, he said 15%, 15% uses up 50%, which is 50.
Right.
I just want to make sure.
Thank you very much.
Just in case you kind of slurred a little bit, I just want to.
Thank you.
There was
We
a lot of
appreciate your
talking in
expertise in math. So think about that for a moment.
Right.
If you have a reinsurer, because this is part of the model of what reinsurance would pick up, you have Berkshire Hathaway.
Berkshire.
If you have a financing mechanism in order to deal with the debt,
JP Morgan.
like JP Morgan, then you have a way in order to handle these expensive therapies. And if you have Amazon dealing with the ordering, delivery, cutting out the profit margins, then not only are you lowering the cost, but you have the model that's identifying from the bank, from JP Morgan, that identifies what the best way to use the drug is, making sure it's being used for the right things so that they can ensure quality. So even when you focus it on just drugs, that's it. So just to summarize, Amazon deals with the logistics of getting the drug, making sure you get it, making sure that it's being done in the right way. JP Morgan comes in and says, we've got tools to make sure the quality is handled, and we'll deal with debt collection in order to deal with cutting the cost so it's not this huge amount of money up front in what you do. And Berkshire Hathaway comes along and says, for those cases that are really expensive, hospital or otherwise, we're going to deal with that so that we lower the cost for everyone else. So in a general way, irregardless of what happens over time, each of these is bringing something important to the table.
And this essentially makes each one collectively kind of self-insurers, right?
Well, they're not just self-insurers, but yes, they are self-insurers. But effectively, they also, from the JP Morgan side, they're not just dealing with mergers and acquisitions and all of that. Now they're going to deal with every individual employee, every individual employee's family, and et cetera. They're looking at it to expand their market.
Right.
But when you look at it to expand the market, I mean, banks don't need other people to figure out how to expand their market, but investment banks do.
Right. So when an employer is buying healthcare, what are the costs involved for the employee?
If you deal with an average individual who's buying insurance, on average, it's about $6,000 a year.
Okay.
If it's a family, and they're usually using a statistical family of 4 people, a husband, wife, and 2 children, then we're looking at somewhere in the range of $14,000 to $15,000 a year to deal with that. Clearly, costs are going up. There is inflation in that. But that's a pretty heavy chunk when you realize that the average income in the United States is about $59,000, and you identify that $14,000 or $15,000 of that is already allocated to healthcare.
Right.
That's a heavy chunk out of what the discretionary income is in order to deal with everything.
Considering the cost of living as well.
Yes.
So how much is the employee? The employee pays a certain amount of the premium.
They do.
As
They
well,
do.
right?
Historically, the employee pays somewhere around 10 to 20% of the total cost. Now, that does not include premium. So if you have premium, you're paying for that every month, whether you use it or whether you don't.
Right. So how does that actually stack up to some of the, like, say, the ACA, or people have been complaining about the ACA's premiums for a long time. How does that stack up?
Well, how it stacks up is that employees today are paying somewhere between 10 and 30% of the total cost.
Okay.
In some cases, it's 100% if it's not covered. The ACA has certain limits on how much people would cover, and there's already talk now about potentially allowing, because there is a certain leverage in the ACA, Affordable Care Act, also known as Obamacare, of putting states together so that states can work out lower cost programs. It already exists in the ACA, whether people have used it or not. Having said that, the bottom line here is that healthcare is expensive, that employees are paying a greater and greater share, and especially in specialty drugs, as we've indicated, that have such a high cost factor.
Right.
The more that you can deal with reinsuring and cutting on the cost for everybody, then young people who look at this and say, well, I'm not sick, I don't need to pay these kind of costs. You run into the law of large numbers that says that everybody has to be included, everybody has to be paying in, or else only the sick are paying in. And as a result of that, their costs are going to rise dramatically regardless.
Right.
So what's the bottom line? The bottom line is that somebody has to deal with not just the premium of care, but this percentage of how much people are paying to find a way to cut that down.
Right.
That's where I believe that this combination of Amazon, JPMorgan, and Berkshire Hathaway is trying to attack the problem in order to address it.
Right. So we talked about some of the things that this new healthcare plan that they're coming up with. Because we know we talked about last week with universal healthcare and some of the problems in trying to come up with the solution, and there's no real solution to any of that or any of the universal healthcare ideas that have come out. What are some problems that this plan could have?
Well, clearly, this combination has not been very specific in publishing what they're doing, and I think part of that has to deal with the fact that this is an experiment.
Of course.
They're trying things out. If it doesn't work, they'll move away. If it does work, they'll build on it and deal with it. We've indicated what each of them does in logistics and getting the drug to you, in JPMorgan in having tools, trying to ensure quality, at the same time trying to cover financial debt, and Berkshire Hathaway dealing with their reinsurance capabilities in order to lower overall costs. So I think that that's a big deal. The problem is that the cost of healthcare is rising irregardless. In the case of new genetic tests, those tests are much more expensive than just the traditional tests of looking at electrolytes of sodium and chloride and potassium and all of that. They're much more expensive. The diseases that in the past could not be treated now are beginning to have treatments based on the new specialty medications. So now there's a treatment for these things that they didn't have before, or we didn't have before. So as a result of that, that's an additional cost. Specialty medications are having at least a 17% increase in cost. So we're looking at, doubling times that are in the 4.5-year range. When I say doubling times, I mean whatever the cost is now, 4 to 5 years later, it's going to cost twice as much. So those issues are baked into the system. And now the question is, what are you going to do legislatively in order to control the cost? What are you going to do from a management standpoint to control the cost? And I think that's where combinations like this with the Amazon, JPMorgan, Berkshire Hathaway are trying to attack that entire thing. They can't deal with the legislative part, but they can certainly deal with all the management part.
It doesn't seem like there's going to be a solution for it. I mean, you mentioned a lot of problems, but these are typical problems for any health plan.
They are. They are.
It wouldn't be centered on just what Amazon, JPMorgan, and Berkshire Hathaway are trying to accomplish.
That's true, and I think as a experiment, they're going to find out things that don't work, etc. When we talked last week about universal health care, we were talking about the different models as they exist around the world, because there is an issue around the world where health care is a right. And so as a result of that, the fundamental argument that everybody has then is how do you pay for it? So now the issue is, okay, if you're going to give people this care, whether it's now or whether it's 4 or 5 years from now in giving care, the question is going to be how you're going to pay for it. Part of that is going to be take the cost as it is and knock the cost down. Find ways to cut that cost. Number two is that more and more people are going to have to pay for it. The notion that that young people, etc., have access so they don't have to pay in, or maybe they will or won't, is nonsense. The law of large numbers says that if you're going to cover people, you have to cover everybody to get a big enough bulk of people paying in, or you're not going to be able to afford it because only sick people will. But having said that, you still have to find models that younger people and healthier people will find acceptable. So even though they're paying in, it's adding to the overall total that is maintaining healthcare for everybody. I think that's why management groups like this are trying to attack the problem. Is there a solution?
No.
There isn't a current solution.
Right.
But clearly, as people do this, they're going to have to find ways of doing it. And my guess is they'll start nibbling around it.
Right.
They won't have a magic bullet that kills the entire thing and makes it work, but they'll keep nibbling around it, whether they lower drug cost, have more restrictive covenants with hospitals, deal with keeping people out of the hospital in the emergency room, dealing with how you move people around and coordination of care for what they do. Those will be how they pick their way around the problem, trying to get a better idea.
Right. And initially, I liked the idea of these three corporations getting together because, like I said at the top of the show, we talked about they cover a large amount of employees, a large amount. I mean, especially Amazon in itself, it's a large amount of employees being included here, and that seems like a large bucket to fill. And if they're going to take money from this amount of the population, it might hurt other plans like the ACA potentially, right?
Well, no. The ACA benefits when the costs are lower because it keeps and brings people in and keeps them into the program.
Okay.
So in a general way, I mean, specifically, there are going to be problems.
Because I'm just thinking in terms of the bucket. Like
Yeah.
If less money going in.
Well, fundamentally, we have several different healthcare systems going on in the United States today anyways. Medicare is one of them. Medicaid for each of the states is the second one. Some states are expanding that. Other states have work requirements. Some people are trying to restrict it. That's an argument going on in every state.
Right.
The third thing is the private insurance. And so I think at least here, where they're attacking the private insurance, the Affordable Care Act kind of exchange of where people are putting it can benefit if costs are identified and they are lowered.
Right.
There's still going to be issues where the different plans will look at this and say, well, if I offer less services, then it's cheaper plan and deal with that. But someone's still going to have to pay for it.
Of course.
So in that regard, if I offer less services and I buy it, if I get sick, I get hurt, I'm injured or whatever, then I'm still going to have to find a way to pay for this kind of thing.
Right.
So I think in an interesting way, bringing together providers and technology people with banks, with insurance company type people, with Berkshire Hathaway, kind of attacks some of the fundamental problems as everybody tries to make that work.
Right. And
no perfect solution.
There is none. And we could talk about this for hours, but we got to move on here. What are some potential solutions? I mean, we mentioned there are no solutions, but there's potential here, though.
There are.
Yeah.
There are. The fundamental issue today in healthcare is to move from volume to value.
Okay.
In the past, people pay for a given drug, and so the provider makes more money by filling more prescriptions. Physicians make more money by seeing more patients. Hospitals make more money by dealing with more surgeries and more services, etc. But now the issue is to pay for the value.
Okay.
So we're not the payer says I'm not going to pay unless I can see that somebody has actually improved. Their blood pressure was decreased, their diabetes was improved. If they had to go for a surgery, can we be assured the fact that there is a positive benefit out of it, et cetera, et cetera, et cetera. So one issue is that, because what does it do? It caps the payment. It's effectively saying, I'm not going to just pay anything for this. I am going to identify what's the value to me, and you have to show that you've provided that value or I'm not going to pay for it. Okay. So volume to value is a huge shift, and it is a major issue. The second issue is that, as we talked about for capping the overall cost value. There's also a benefit or one option in capping the overall cost to physicians and other providers. Effectively, what's done is to say, I'm offering you so much money per patient per month to treat them, whether they have no problems, one problem, two problems, five problems, or whatever. You're getting paid one way. You'll make money on the people that are healthy. You'll either break even or lose money on the people that are sicker, but either way, you find a way to do that. A third way is the ACOs, and that's where you take groups of providers, physicians, nurses, pharmacists, etc. They're all included in the group. So in a way, you're kind of capping the group. You're coming up with limits, but their job is to look at this and say, well, how can we give the quality but keep the costs low? And it's not just one silo, it's all silos getting together.
What are ACOs again? I'm asking for a friend.
An ACO is an accountable care organization.
Right.
It's kind of like...
I'm sure none of you at home knew what that was.
An ACO is like what some people have called medical homes. So it's a group of medical homes.
Okay.
But at the end of the day, to be kind of simplistic about it, you have a doctor who's kind of the coach of the team, and says this patient needs this kind of care. So they send them to a cardiologist or a nephrologist for kidney or GI guy, whatever. And they need certain prescriptions, so they're going to need it from this particular pharmacy. Well, in this case, everybody's feeding in knowledge and saying, no, don't prescribe that drug, there's a cheaper drug. The cardiologist looks at it and says, no, if we can keep this person stable, they don't have to come and see me all the time.
Right.
And the primary care person is worried about coordinating this whole thing. So it's the coach, it's the team, they have offense, they have defense, they have all these particular players, but they're trying to put the whole thing together so that you're not overusing the specialty team, you're not underutilizing the defense or offense, you're trying to bring everybody together, and that's what goes on.
Yeah, and that seems like a great solution, and it makes sense on its face, because I believe a lot of people were looking for private industry to kind of come in and try to tackle this thing head on. And it seems like Amazon, JPMORGAN, and Berkshire Hathaway are kind of looking at solutions to bring down the cost of healthcare in general.
Well, I think in a general way, to kind of bring this to closure, when we look at the federal government, there haven't been a lot of easy solutions because there's so much arguing about what goes on in order to try and get activity. Right. Each of the states has begun to exercise their responsibility for the people in their state about what they do.
Of course.
So that's an option to what's going on in the federal government as each state begins to define what they think is an appropriate way to handle their population.
Right, because each state's population is dramatically different from one to the other.
They may be the same, and now they have an opportunity to buddy up and say what they can do, and then go back to the federal government and say, release these regulations so that we can work together better.
Right.
And the third thing, of course, is that companies, no matter what kind of company, have had to solve problems. That's what they do.
Because they want to stay in business.
They want to stay in business. So when you bring people together, in this case from different kind of businesses, you're saying, here's the problem, figure out a way to solve it. It doesn't mean that you start with the solution. It means that you start working your way through it. And in any business,
right,
you take a look at it and you try something. If it works, you stick with it. If it doesn't work, you get rid of it and you try something else.
Right.
So in all of this case, they're looking at private industry to try and solve the problem. States are trying to solve their problem. The federal government, depending on whether they can make decisions, will eventually solve some problems. But at the end of the day, it's multiple different groups trying to figure out how to solve what's going on in healthcare.
Right. Well, it's a very interesting topic, and we'll probably know more in the coming months about whether or not they choose to go on with this experiment, or they release some kind of plan of what they plan to do with this experiment, and we'll probably approach this topic again. And thank you very much, Dr. Stern.
Thank you.
And I would like to remind you all at home, please visit ProPharmaConsultants.com. We have a free information page called RxInfoX that has a load of information and a load of healthcare topics that are being approached around the world, not just here in the United States. And yes, sir?
Can I add one thing? Alex did something for me on our RX Info X page. He added a ticker, like a stock ticker, that has the cost of drugs.
Right.
And it's big. It's got a couple thousand, but it ticks through all day long, identifying what the costs are. We're going to add more to that, but you should take a look at that. And you can thank Alex for the technical part of making that happen.
And I'll take all the credit in the world for it, and I'll continue to expand on it. And Dr. Stern has wrote a bunch of articles. While we keep patting each other on the back, you can be assured to go to rate, review, and subscribe to Pro Pharma Talks. And that's it for today. We'll see you next week.